So to understand the peritoneum, these two sections are immensely important. Now I wanted to understand a couple of things before we start in this. Now this is a transverse section of the abdominal cavity taken in such a way that you're seeing it from above. आप ऊपर से देख रहे हैं इसको, you're seeing it from above. Here's the liver, the stomach, the spleen. And you can see the peritoneum is connecting the spleen to the kidney, connecting the spleen to the stomach, connecting the stomach to the liver here. And this peritoneum, which is extending from the, what do you say, from the stomach, is extending toward the liver, but is not shown to the connected to the liver here. Although it is connected to the liver here, but the section is taken slightly from the lower part where it is not connected to the liver to find out the epiploic foramen, to see where the epiploic foramen is. The first and the foremost, guys, if you look at this viscera here, these viscera here, this obviously is the liver. Here's the stomach, the spleen. We got this left kidney, we got this right kidney. Here we got the aorta, and that is the inferior vena cava. There is aorta there, and that's inferior vena cava. See, just look at these peritoneal folds one by one, and then we will talk about them. You can see a peritoneal fold which is connecting the spleen to the kidney. And this peritoneal fold connecting the spleen to the kidney is called as a linorenal ligament, or you can say splenorenal ligament, guys. So it's a linorenal ligament or splenorenal ligament. Now this, what exactly this linorenal ligament is holding? The advantage of this ligament is that aorta will give off the celiac trunk. We all know the branch from the aorta is celiac trunk, and celiac trunk will give off the splenic artery. How splenic artery will reach the spleen? Splenic artery will go behind like this on the posterior wall, and then will use this ligament to reach the spleen. So one of the content of this ligament, the linorenal ligament, will be the splenic artery. That's how the splenic artery is going to reach the spleen. So one content of the linorenal ligament is going to be the splenic artery. And other content which you should not be surprised of, that is the tail of pancreas is also there. Guys, pancreas is a retroperitoneal structure. Agreed. It is on the posterior wall. Not shown in this picture here. Actually, this is a little lower. Pancreas is a little lower. Pancreas is present on the posterior wall. Now, pancreas is retroperitoneal, but the tail of pancreas is present in this ligament, and that's how the tail of pancreas is in relation to the hilum of the spleen. I'm sure you all must have read that in splenectomy, the one thing you are very careful about is the tail of pancreas. You have to mobilize the tail of pancreas so that you don't injure it, because maximum islet of Langerhans are present in the tail of pancreas only, and that is in relation to the spleen. Why it is in relation to spleen? Because it is using this ligament to reach there. So there are two contents of linorenal ligament. One is the splenic artery, and then we have the tail of pancreas is also present inside. Then you can see a peritoneal fold which is connecting the spleen to the stomach. Now this peritoneal fold connecting the spleen to the stomach is called as the gastrosplenic ligament. That is a gastrosplenic ligament. Guys, gastrosplenic ligament here, this gastrosplenic ligament is carrying what? See, once the splenic artery reach there, see, it's all very logical. Once the splenic artery reach there are some branches of splenic artery which supplies the stomach also, which supplies the stomach along the greater curvature. So if you look at the greater curvature of stomach, we have blood vessels going above our short gastric arteries, and the artery which is going downward along the greater curvature is called as left gastroepiploic artery, and they both start in this ligament only. One will run above and one will run downward here. Both coming from where? From the splenic artery only. So the branches of splenic artery given along the greater curvature of stomach are the content here. Branches of splenic artery given along the greater curvature of stomach, the arteries, like we have short gastric arteries, and then we also have the left gastroepiploic arteries, left gastroepiploic artery. So these are the two contents of what ligament? The gastrosplenic ligament. Okay. That's lesser omentum. Now before I come to the contents of lesser omentum, let me take your attention to another ligament which is connecting the liver to the anterior abdominal wall. You can see that ligament over there. That is a ligament called as a falciform ligament. That ligament there is a falciform ligament, and that is connecting the liver to anterior abdominal wall. And I just told you falciform ligament content is a ligament only that is called as ligamentum teres. The ligamentum teres, which is obliterated left umbilical vein, is present between the two folds of the falciform ligament only. So till now in this section I can see three major ligaments here, the linorenal, the gastrosplenic and the falciform ligament, and what exactly they are holding inside. Coming to lesser omentum, guys, the important, if I just enlarge this lesser omentum, you can see lesser omentum is having some blood vessels present along the lesser curvature of stomach. And this lesser omentum is having some structures present in the free margin. The portal triad is in the free margin, and the attached margin is having the gastric arteries, right gastric and left gastric artery. So this is the lesser omentum that is lesser omentum. Lesser omentum, and guys, lesser omentum, as I said, is having two margins. We have a attached and the free margin. We've got an attached margin and we have free margin of lesser omentum. Now the attached margin of the lesser omentum here, that is attached to the stomach, is having the gastric arteries. We all know along the lesser curvature of stomach, we have the left gastric artery and we have right gastric artery. So gastric vessels are there. In the attached margin, we have right gastric artery and we got the left gastric artery. Will be there in what margin? In the attached margin. Whereas in the free margin, you can see clearly in the free margin of lesser omentum, we have the entire portal triad is there. In the free margin, portal triad is there. That means we have portal vein, hepatic artery and bile duct. Portal vein, hepatic artery and bile duct are all present in what margin? In the free margin. So these are the contents of the lesser omentum. So when you write the contents of lesser omentum, you have to write both free margin, attached margin content and the free margin content here. So guys, these are the four important, the major ligament that you should know on in the transverse section as of now. That, and what are their contents here? The linorenal ligament, the gastrosplenic ligament, the falciform ligament and the lesser omentum and their contents. Where is greater sac and lesser sac in this picture, guys? Where do we have a greater sac and lesser sac in this image? The lesser sac is the one which is present behind the stomach and lesser omentum. So in this image, this here is the lesser sac, the one which I have highlighted for you, this yellow color here. This is a lesser sac. I just put an asterisk sign there, guys. This is the lesser sac. Lesser sac, just be careful, it is also known as, there is another name for it. Lesser sac is also known as the omental bursa. Lesser sac, it is also referred as omental bursa. Omental bursa. Lesser sac, or you can call it omental bursa. This lesser sac, it communicates with the greater sac which is in front. This everything in front is greater sac, guys. This is greater sac. Look at this space around the spleen, space around the stomach, space in front of liver. All this is greater sac. And this greater sac in front, the greater sac in front here and lesser sac here, they are connected to each other by epiploic foramen. And that epiploic foramen, now important thing is, where is epiploic foramen? Now this is not epiploic foramen. Epiploic foramen is behind here, guys, where I'm pointing at right now. Look at this. That's the exact one where my finger is. This is the epiploic foramen here, which is behind the free margin, not beside, behind the free margin of lesser omentum. It is just behind the free margin of lesser omentum. That opening here is called as a epiploic foramen. One of the most asked question from the abdomen, the epiploic foramen. So guys, this space here is called as the epiploic foramen. You can call it epiploic foramen. You can also call it the foramen of Winslow. Epiploic foramen or foramen of Winslow. And like definitely one of the very, very important topic, and repeated questions are asked on here. Now, what are the relations of epiploic foramen? We can appreciate those relations from here only. Guys, the anterior relation of epiploic foramen, as you can see there, the anterior relation of epiploic foramen are portal triad. Portal triad is anterior relation. You have portal vein there. You got a hepatic artery and bile duct. You can see that. Look at that. Exactly in front of the epiploic foramen, we have this portal triad present, and they are the anterior relation. Posterior relation. Posterior relation is inferior vena cava. You can see that inferior vena cava is behind. Can you see that gland over there, guys? That's a right suprarenal gland. That is a right suprarenal gland, and that is a body of 12th thoracic vertebrae. Main relation is IVC. That's the speciality of the epiploic foramen. Why we are so bothered about the epiploic foramen? Because you cannot increase the size of epiploic foramen. We have portal vein in front and we have inferior vena cava behind. You cannot compromise on any of these blood vessels here. And that's why the relations of the epiploic foramen are so important and asked frequently. So guys, in the posterior relation we have IVC, we have right suprarenal gland, that's the suprarenal gland here, and even the 12th thoracic vertebra body is there. So in the posterior relation, we got IVC, inferior vena cava. That is a right suprarenal gland. Let me keep writing it here. That guys, right suprarenal gland. Right suprarenal gland, and this T12, body of 12th thoracic vertebrae. So the anterior relation is the portal triad, and posterior relation is IVC, right suprarenal gland, and the body of the 12th thoracic vertebrae. In this section, I can see only the anterior relation and the posterior relation. I cannot see the roof, I cannot see the floor. What is the roof and the floor, guys? If this is my lesser omentum, look at me, let's say this is my lesser omentum, my epiploic foramen is just behind the free margin here. So if epiploic foramen is somewhere here in this region, so above the epiploic foramen is liver only. And below the epiploic foramen is the first part of duodenum. When the duodenum, horizontal part of duodenum goes like this and then downward, so first part of duodenum is below the epiploic foramen. So the relation which are to be written here, guys, that the roof and the floor. If I cannot see in that image, but remember that the roof of the epiploic foramen is by the caudate lobe of liver. Whereas the floor of epiploic foramen is the first part of duodenum. First part of duodenum. Do not commit the mistake of writing the pylorus of stomach. Pylorus of stomach is given in the option. That's not the right answer, guys. In the floor of epiploic foramen, it's not the pylorus of stomach. It's more toward the right side. It's the first part of duodenum. The first part of duodenum. So these are extremely important relations of epiploic foramen here. So epiploic foramen, anterior, posterior. So anteriorly, if you just look at the major relations here, we have portal vein in front, we have inferior vena cava behind, we have caudate lobe above, and we have duodenum below. So we have 4 such important relations around the epiploic foramen, and that's the reason you cannot increase the size of epiploic foramen even in case of the internal hernia. So these are the few things, guys, we understood from this section here, the transverse section, some peritoneum, their folds, where is a lesser sac, epiploic foramen, and the relation here. Now let's take a sagittal section, and the sagittal section will tell you how these structures are displaced. How the peritoneum is displaced longitudinally, and what is the dependent site of the peritoneal cavity in that position. Now this here is a sagittal section, guys. Needless to say, that's a sagittal section, the mid-sagittal section. In this section, once again, this is liver. Here is stomach. This is transverse colon. I'm writing TC for transverse colon here, that is transverse colon. And all this is small intestine. These are the coils of small intestine. I'm writing SI for small intestine. Okay. So once again, what do you see? That between the liver and the stomach, you have this peritoneal fold. So see if they've shown the epiploic foramen there. They've shown the epiploic foramen, how greater sac is going into lesser sac. That blue colored sac here is a lesser sac only. So first of all, this peritoneal fold here is a lesser omentum only. That is lesser omentum. Stomach, and after the stomach, now this is something to be seen carefully. Now you see, guys, from the stomach you can see a peritoneal fold, double layer of peritoneum, one from the anterior part of stomach, one from posterior part. This double layer of peritoneum, it goes down indefinitely and comes back again to the transverse colon and covers the transverse colon and forms the transverse mesocolon. So this basically is a 4-layered structure, and this 4-layered structure is what you call as the greater omentum. That is greater omentum. So it is extending from the stomach. An important thing is it is going back to transverse colon. It comes from the stomach and goes back to transverse colon. So this becomes a 4-layer. 2 layer goes down and 2 layer comes up. So that makes a 4 layer in total. So that's greater omentum. And the thing about greater omentum is that greater omentum lower border is free. It's a free lower border. So when a surgeon opens the anterior abdominal wall and they have to explore the small intestine or any other structure, they can simply lift the greater omentum. You can just open the anterior abdominal wall, the greater omentum will be lying like this, and you can just lift the greater omentum above. Because thankfully the lower border of greater omentum is free. You can always lift it. This fold of peritoneum which is holding the transverse colon to the posterior wall is called as transverse mesocolon. Transverse mesocolon. And this fold of peritoneum which is holding the small intestine is mesentery. That's a mesentery there. Thus, the fold of peritoneum holding the small intestine, that is a mesentery part. Well, this, as I can make out from the lower part of this section, that's a section from the female perineum. So we can see the rectum and the uterus can be seen, and there will be pouch. The recto-uterine pouch of Douglas will be there. So the pouch which will be present in there, whatever I can see, let me mark that. That pouch which is present between the rectum and the uterus, that's a recto-uterine pouch. Now a recto-uterine pouch, obviously in female, had it been the section of male, the pouch here will be the rectovesicular between the bladder. So rectovesicular pouch would have been there in case of male. Now whether it is rectovesicular pouch or recto-uterine pouch, these are called as pouch of Douglas, and they are the most dependent site of peritoneal cavity in the erect position. In the sitting and standing, they are the most dependent site of peritoneal cavity. The most dependent site of peritoneal cavity. In erect position. The important thing is in erect position. In erect position. Because in lying position, it will be the hepatorenal pouch of Morrison. The Morrison's pouch, the one which is behind the liver, guys. In supine position, the answer will change. In supine position, the most dependent site of the peritoneal cavity will be the hepatorenal pouch of Morrison, or you can simply say Morrison's pouch. Hepatorenal pouch of Morrison or Morrison's pouch is the most dependent site of the peritoneal cavity in the supine lying position. Now coming back to the same section here, guys, see, the thing is, this cavity, the one which is marked with the blue color here, this cavity is the another view of the lesser sac only. So the main thing here is to discuss about the lesser sac itself, guys. Lesser sac or omental bursa. Lesser sac or omental bursa. Now why lesser sac or omental bursa is so important, surgically why it is so important? See, there are two reasons for that. The lesser sac is important for two important reasons. One, that if there is any herniation from the greater sac into lesser sac, that will come through the epiploic foramen. So there are chances that some structures can herniate through the epiploic foramen and into the lesser sac here. So that's, you should know that where the lesser sac is. And more importantly, we know that stomach, guys, posterior wall of the stomach along the lesser curvature is more vulnerable or susceptible to the ulceration. If there is an ulceration of the posterior wall of stomach, then the content of the stomach will leak into the lesser sac only. If the content of the stomach leaks into the lesser sac here, then one should know the anatomy of the lesser sac, because we need to drain it here. And that's why, again, this being a clinically important space, they do ask question on the relations of the lesser sac. The relations of lesser sac, see, it's very simple, guys. Anterior relation of lesser sac, you can see it clear. Liver is there, lesser omentum is there, stomach is there, and some part of greater omentum is also there in the anterior relation. How do you want to remember the posterior relation? Now, instead of remembering everything in the posterior relation, just remember everything that is behind the stomach is behind the lesser sac also, except one structure, and that you can make out from here. If you look at, guys, stomach, all the posterior relation of stomach like kidney and aorta and crus of the diaphragm and suprarenal gland, whatever, we know that stomach bed, guys, all the structures of stomach bed are also behind the lesser sac except spleen. Spleen is behind the stomach, but spleen is not behind the lesser sac here. So it is just about, every time the question they ask on this, it is about the spleen here, that which of the following structure is not present in the posterior relation of the spleen, in the posterior relation of the lesser sac. So it's everything that is there in the stomach bed except the spleen, except the spleen. So in the relations of the lesser sac, from the picture we can make out that anterior relation here, the anterior relation of the lesser sac is by starting from the liver here, guys, that's the caudate lobe of liver. That's a caudate lobe of liver. Then after the caudate lobe of liver, you can see the lesser omentum is there. After lesser omentum, there is stomach. And after stomach, below the stomach, you can see some part of greater omentum also. Some part of greater omentum also. So all these structures, caudate lobe of liver, the lesser omentum, the stomach, and the first two layer you can see, or just simply the greater omentum, some part of greater omentum is the anterior relation of lesser sac. Posterior relation, don't bother, guys. Just only thing which I suggest you to write down here, that in the posterior relation of liver, we have all structures of stomach bed, all structures of stomach bed. We all read about stomach bed, guys, in surgery also. Stomach bed, what is there behind the stomach? Like left kidney, left suprarenal gland, left splenic flexure of colon, whatever. All the structures which are in the stomach bed are also in the lesser sac. But the important thing, and on which the questions are targeted, except spleen. Spleen is there in the stomach bed, but spleen is not there in the relation of the lesser sac. So except spleen, except spleen. So this is about the lesser sac. The anterior relation is caudate lobe, lesser omentum, stomach, and greater omentum. Posterior relation is just about the content or structures of the stomach bed, the relations, the posterior relation of the stomach, you can say, except the spleen, which is not there in the lesser sac relation. Spleen has nothing to do with the relation of lesser sac. Spleen is not there in any relation of lesser sac, guys. Remember that.